If pigmentation, acne marks, or dull skin are bothering you, a chemical peel might have come up in conversation. A chemical peel applies an acid solution to the skin, removing damaged outer layers so smoother, more even skin can grow underneath. Peels are grouped by depth. Superficial peels work on the surface, medium peels reach the upper dermis, and deep peels go further. Different acids do different jobs. Glycolic and lactic acids brighten, salicylic acid clears pores, and stronger TCA tackles deeper concerns. Dermatologists often consider peels for pigmentation, sun damage, acne marks, fine lines, dullness, and uneven texture. For darker skin tones, gentler acids like mandelic and low-strength glycolic are often preferred to reduce the risk of pigment changes. Before the peel, the skin is cleansed and degreased. Sensitive spots around the eyes, nostrils, and lips are protected. The clinician brushes the acid solution evenly across the skin, watching closely for the color change that shows how deeply it's working. You may feel tingling or warmth with light peels and more noticeable stinging with medium peels. A small fan helps with comfort. Superficial peels cause mild redness and light flaking for a few days. Medium peels involve visible peeling for about a week. After a peel, sunscreen is essential. Avoid picking flaking skin, hot showers, saunas, and harsh actives like retinoids until cleared. Risks include temporary darkening or lightening, persistent redness, and rarely scarring or cold sore reactivation in people prone to them. Most concerns need a series of 4 to 6 superficial peels with maintenance sessions and daily sunscreen to keep results going. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.